Okay, well, good afternoon, everyone. Thank you so much for joining us this afternoon. My name is Jennifer White, Senior Policy and Community Engagement Officer at the Horizon Foundation. And on behalf of the Foundation, Alpha Phi Alpha Fraternity Incorporated, Kappa Phi Lambda Chapter, and Onyx Medical Society, we welcome you to Decision Point, COVID-19 Vaccine Webinar. We appreciate you taking the time out to join us this afternoon to hear more about where we are now in this pandemic, receive trusted information from our panel of experts about the vaccine and how to keep ourselves safe and healthy. You'll hear from a variety of perspectives. We have an outstanding panel, and so this session will provide you with an opportunity to receive the latest information about COVID in an interactive and supportive way. We are pleased to present this webinar and this distinguished panel for the hour. Please know that this webinar is being recorded, so this may be shared and disseminated after the webinar is over. And so to kick things off, our session will be moderated by Dr. Marvin Mitchell. Dr. Mitchell is a health scientist for food safety and applied nutrition with the U.S. Food and Drug Administration. In his current role at the FDA, he responds to foodborne outbreaks and leads regulatory oversight for novel tobacco products like IQOS and others. Dr. Mitchell has been deployed across this country to respond to humanitarian crises and even provided psychotherapeutic services to passengers and crew of the Grand Princess cruise ship related to COVID-19, and most recently deployed to Navajo Nation for COVID-19 relief. He received his Bachelor's of Arts in Social Welfare from the University of California at Berkeley, his Master of Social Work from Cal State University, Sacramento, and his Doctor of Health Science from A.T. Still University. Again, we are in for such a treat this afternoon, and without further ado, I will turn things over to Dr. Mitchell, who will introduce our panelists. Dr. Mitchell.
Thank you, Ms. White. We are super excited for everybody to be here. Glad to see you, whether you're watching live or the recorded session. We appreciate your time and for coming out on a Saturday afternoon. Quick disclaimer that I have to make. My title there is I am a health scientist with FDA. The disclaimer that I have to make here is because this is not an officially sanctioned FDA activity, then my title there is just to indicate who I am, but in no way should this be viewed as something official from FDA, and these opinions that are expressed here would be my own. Now, with that out of the way, let me get to talking about our esteemed panelists here. We have Dr. Dwayne Dyson. He was on the COVID-19 task force for Alpha Phi Alpha Fraternity Incorporated. He is a pediatrician in Tucson, and I have had the pleasure of knowing this brother from our days together at the University of California at Berkeley. My sans, Dr. Dwayne Dyson. We also have Dr. Shoshana Kindred. She is the founder and president of the Onyx Medical Society, an esteemed panelist here in Howard County. And thank you for coming here, Dr. Kindred. We also have Mr. Arnell Dreit Jr. He is a senior clinical research coordinator at Johns Hopkins University, right here, one of the leading, if not the leading, public health institution in the nation and arguably the world. And then we have Dr. Mara J. Rossman. She is a health officer here in Howard County Health Department. We are going to kick things off here by starting off with Dr. Rossman and giving us an overview of the COVID landscape in Howard County and what is happening here in our community. Dr. Rossman.
Hello, good afternoon, everyone. I'm Dr. Maura Rossman. I am the health officer for Howard County Health Department. I want to thank Alpha Phi Alpha and Horizon Foundation and the esteemed panelist, Dr. Mitchell, for inviting me and providing public health an opportunity to share this afternoon. I've been asked to talk about where we are with COVID-19, and with reflection, this has been almost 2 years, 21 months that we've been in this pandemic, and it's been quite a ride. Right now, we're in the 5th wave. And right now things are looking very good on the downside, trending down in terms of our cases. I'm optimistic for a number of reasons, mostly because of vaccine. And I know we'll be addressing lots of questions about the vaccine today. So I will keep my remarks on that. But right now in Howard County, our positivity rate and our case rate still places us in something called the substantial risk for our community. And the CDC recommends that communities of substantial risk continue to wear masks when indoors in public spaces, physically distanced. So while I will tell you that things are getting better, and I am very optimistic about hopefully the next few weeks and months, particularly in light of the additional authorization of boosters coming and authorization of vaccine for our children, we still need to be cautious and continue to implement all the strategies that we have been doing for months to protect ourselves and our loved ones from getting sick and dying from COVID-19. Howard County is a remarkable community. We seek out credible information like everyone who is listening today. I am happy to report that of all persons eligible for vaccine in Howard County, 93% have received at least one dose. And I'm looking down, almost 88% are fully vaccinated. Absolutely remarkable. And I credit that to the workers at the health department who have been working pretty much 7/24 for the past 21 months, but really also to the partners, including Alpha Phi Alpha and everyone, Horizon Foundation, who has been disseminating information so that everyone in our community can make educated decisions about the options that are out there. I'm also really thrilled to report that in terms of equity, a big question about demographic and who has getting vaccine, we certainly know in the beginning of COVID that minority populations were hardest hit in terms of the morbidity and mortality, and especially vulnerable were our seniors and vulnerable, medically vulnerable who lived in nursing homes. In terms of equity, in terms of proportion of population by demographic who has gotten vaccine, is pretty much equal to the population. So if 20% of Howard County describe themselves as African American or Black, then pretty much 20% have been vaccinated. So we're not seeing at this point inequities in terms of vaccine uptake. And again, we've had other of these type of discussions over the course of time to really get out this credible information so that, in my opinion, people are making healthy and educated decisions to the point where right now, where our cases are trending down. Our kids are in school. I'm a pediatrician by training. And certainly I think we all were concerned with the beginning of in-person learning, which we recognize as so important for all of our children. Many of us were concerned about whether or not cases would go up. While we have seen certainly in the past couple of months an increase in the number of cases among our children, it is not as, I'm going to say, dire as we thought. But any child who gets sick with COVID certainly is a concern. I'll end by saying who is at most risk at this point, and it continues to be those who are unvaccinated. Our children, vaccine is currently approved for 12 and up. So I really hope everyone who hears this, if you haven't yet been vaccinated and you're eligible to be vaccinated, please get vaccinated for yourself, for your others, and for our kids. And I expect sometime around Halloween or the beginning of November for our 5 to 11-year-olds to be eligible for vaccination. And perhaps today we'll talk about the efficacy and the safety of vaccine for our children, so our parents and guardians can again make the best decision for our kids. So I'll end there and thank everyone.
Thank you for all that, Dr. Rossman. We'll move next to Dr. Dwayne Dyson. And Dr. Dyson, folks in the community want to know, is this vaccine really safe? And
Very much. Oh, go ahead.
what do we really know about it? They want to know two things.
Okay. In terms of the safety, yes, anything that the FDA is going to put their stamp on is going to be safe. The question is, how safe is it going to be still with the booster, considering that there is a little issue during the summer with more so men than women in their 20s through 40 that had their booster dose. They had some cardiac issues that it was a trend, yes, but it was significant enough for it to make the media, but not significant enough for people to be dissuaded from getting the vaccine. But outside of that safety risk, everything else is on par, even for pregnant women, nursing women, anywhere along that path, everyone should get it. And then, as Dr. Rossman mentioned, we're looking at kids getting it ideally kids under 12, ideally in the next few weeks. That recommendation will come out ideally 5 and older. Right now, as you mentioned, it's 12 and older, but soon we'll get to 5 and older, and that'll really help curb the numbers going forward. So safety, yes, it's great. The Delta variant, not so much. And so for that reason, as the recommendation by the CDC is out that people go back to wearing masks, I'm in full agreement with. People that are vaccinated go back to wearing masks, because the Delta variant, you're only looking at about 80% protection from that one if you've had both your vaccines. So before you look at 95% protection, my family would run around without masks. We're all vaccinated, except my 9-year-old, and he'd have to wear a mask. But now with the Delta variant only being about 80% covered with the vaccines, those who are fully vaccinated, it's 20% isn't worth the risk. So it's that I'm still recommending people go back to wearing masks.
So thank you for that, Dr. Dyson. I have a follow-up on something that you talked about. And when you were basically what we refer to as adverse events with whether it's a vaccine or some other type of intervention. So that is one of the concerns that folks have in the community, is that they see these adverse events that some of which you were referencing. Could you speak a little bit about how with any type of intervention, and specifically with vaccines, that there are adverse events that are unavoidable, and that if the adverse events with this vaccine have been as you said, that makes it so that this vaccine is unsafe. I want to make sure I'm trying to be clear, because one of the contentions that folks have is that they see these media events where there have been some adverse events with this vaccine. Does that alone mean that we should throw the baby out with the bathwater, so to speak?
No. Overall, to your point, regardless of anything that you put in your body, there's going to be, if you have enough people consume it or receive it, there's going to be some adverse events. And so in terms of the studies that have been done for the COVID vaccines, those adverse events really more so related to your blood, in terms of clotting issues in your blood and brain issues. I'll keep it simple that way, as brain issues. All those have been right about on par with people who have not been vaccinated, as opposed, with those who've received 1 or 2 doses of the vaccine. So there really hasn't been any significant uptick in adverse events, save the fact of the myocarditis and other heart issues that came along with this summer. They've discovered, as I said, more so males, but people in their 20s through 40. But even with that, I still recommend that people get their vaccine. It's still safe. So like I said, you can consume a food product and have an adverse event, at the same time consume a vaccine or receive a vaccine and have an adverse event. But overall, statistically speaking, it's about the adverse events for those who are unvaccinated compared to those who are vaccinated are about the same, such that what you see in the media, it's kind of like what you see online. If you were to Google any health illness that your family member might have, if you put that health illness in the Google search and pull it up, you'll see the most horrific pictures and all the worst horror stories about it, because those are the people that are actually going to comment on it. So it's going to be the same in this setting. The majority of the people, the vast majority, are doing well. And then you have those few outliers, and God help them, but they've had some bad outcomes.
Thank you for that. I appreciate that, because I know that's something that when you were talking about adverse events, that folks may gloss over that. But I know that's a concern in the community. So thank you. The next question we have is usually takes a long time for FDA approval. This thing went so fast. How did they develop it so quickly? So I just wanted to make a couple of remarks and then I'll open it up to the panelists. With FDA, what we're looking at is kind of two different tracks, and we're looking at approval, and we're also looking at when there's been a pandemic or some type of public health emergency like there was, then FDA has an additional authorization called emergency use authorization. And for the requirement for approval is what we call the safe and effective standard. And that's the standard that's usually used for FDA approval. But for FDA authorization, for emergency use authorization, the standard is a little bit different, because when you have a pandemic, then in order to enact EUA, then the standard is what FDA is looking at is this intervention more likely than not to provide some help if we don't do anything? So those are two different standards FDA has on approval and emergency use authorization. One other point on that was how to go so fast. There was HHS developed something called Operation Warp Speed, and mRNA vaccines have been being researched for a while through our colleagues at NIH for at least a couple of decades, as far as I'm understanding. But you coupling that with Operation Warp Speed, then they were able to, and the EUA, then we were able to get this out to the public a little bit faster. All those terms, I know we're going really quickly. All those terms, you can go back and look at the recording, and this is all public information on the internet. But any of the panelists wanted to hop in and provide anything more specific than what I just said?
I did. I wanted to maybe break it down the way I do with my patients, because I get the same question as well. And the way, like when I was in residency and we did clinical trials, we did it in phases. We did one phase, wait till that was done, move to the next phase, wait till that was done. So that's why it took a good 5-10 years for things to develop. But that is not the appropriate strategy, right, for a pandemic. So what happened instead is you had the first phase, but you also had the second, third phase all happening at the same time, and more than one version of the medication or the drug or the antibody or the vaccine in each phase all at the same time. So instead of it was 1, 2, 3, 1, 2, 3 was happening in many versions at the same time. And the second reason is basically technology has certainly advanced, and thankfully so, because when we did come across this pandemic, we weren't as bad off as we would have been, say, 15, 20 years ago. That's how I explain it to my patients.
Thank you. Any other panelists wanted to pop in for 30 seconds to a minute on comments on that? Looks like Dr. Rossman is leaning forward.
I'm just going to say that, as you mentioned, this technology of the mRNA and even the J&J, the technology has been around for decades, and it is used in current vaccines that we vaccinate both children and adult. So while it seems like it was warp speed, and it was, and quite frankly, I think it was a miracle. I mean, I call this a miracle, that these things have been around a long time, and all of us are very used to these technologies if we are vaccinating our children.
Thank you. Anyone else?
Dr. Dyson, I'll also jump in and say, in echoing what Dr. Kendrick said, that since it was all done simultaneously, keep in mind that safety is the first phase and it flows all the way through the third phase. So before they even get to effectiveness of the vaccine, it starts off with, the thousands of people, tens of thousands of people they had involved in the studies. That all starts off with, are they going to be safe? Are they going to suffer any major, as you were talking about, or we were talking about earlier, side effects of the vaccine? And then you get into phase 2 and really phase 3 of effectiveness. So the fact that they were doing them all simultaneously, it was awesome. But once again, it was fast tracked for the point that we were in the midst of going into a pandemic. And when it's all said and done, as I started off by saying, when the FDA puts their stamp on it, it's their stamp. Regardless of it took 7-8 years for it to come to fruition, for it to come to light, the vaccine, or if it took only 9 months, they still put their stamp on it. Right,
and that stamp that Dr. Dyson is referencing is teams of, and I've been involved in FDA review, it's teams of scientists, epidemiologists, toxicologists, social scientists. They're looking at this from every angle. And there's literally, especially for these vaccines, since they were so high profile, there were hundreds of folks involved in reviewing this. So it's very, very thorough. Let me go to the next question, and that is, what is the point of the booster shots? Do the vaccines actually work? If you have to get a booster, that will go to Mr. Arnell Dreit.
Yes. So the answer to the second part of that question is yes, and I want to explain why. So first, it's important to really understand what vaccines are. So vaccines help protect us from dangerous viruses and bacteria, right? And so once you've had a shot for a particular disease, you might think you're safe from it, but that might not necessarily always be the case. So for some diseases, you need an additional shot to help build a stronger immune system, just in case you come in contact with that virus or that disease again, or that bacteria again. And oftentimes viruses can change, or what we say mutate, and that makes your vaccine less effective. And so that's where the extra dose of getting a vaccine comes in, and that's called a booster shot. And that's pretty much what's happening right now with COVID-19 vaccines. There was some initial evidence for the Pfizer and Moderna vaccines that suggested that there's a concept of waning immunity. So you get a vaccine and then over time, it becomes less effective. And so, but some recent data from clinical trials have shown that getting a booster shot will actually create an uptick or increase in a person's immune response if they come into contact with that infectious disease or COVID-19. And so they also saw that those that finished the primary series 6 months ago, that's what the data suggested, that a booster shot would help boost their immune system. And so that's why the US government pretty much announced recently, I think it was September 20th maybe, that they were going to authorize booster shots for Pfizer and Moderna nationwide to adults that were 18 and older. And there's some, particularly there are some criteria that for individuals, it's more important for them to get it. So if you're 65 years and older, if you live in a long-term care facility or setting, if you have any sort of underlying conditions like chronic diseases or like hypertension, cancer, HIV, things like that, diabetes, and also if you live and work in a high-risk setting.
Okay, thank you for that, Mr. Dreit. And we'll go to the last question that we have here, and that is, how can people keep themselves safe and healthy as we continue to navigate this pandemic? And that will be for Dr. Kendrick.
Thank you. So one of the easiest ways, or the most important actually, is to be vaccinated. I can tell you that my friends that are working in a hospital, they're tired, they're spread thin, they're worn out, and they can't deliver the level of care that they should and that patients deserve. Next, one way to think of it is when you're in a setting, assume there's one person in that indoor setting, in that public setting, that has COVID and you don't know who it is. Naturally, you'll wear a mask. Naturally, you'll tend to stay 6 feet apart if you can. Use hand sanitizers when it's available. Wash your hands when it's appropriate. That's very important. And sometimes you can't leave it up to us, the doctors and nurses, to be the heroes. Sometimes you guys need to be the heroes, right? Sometimes you need to tell the person in the room, bring the mask up over your nose or wear the mask. I hate the healthcare hero thing because it makes it seem like the responsibility falls all on us. We're tired. So we need everyone to take this responsibility, wear the mask, and maybe you can't have a big birthday party for your sixth grader this year. You know, think of a safer way to do it. It's these little daily decisions that is actually going to make the biggest difference of all. So please keep that in mind.
This is Dr. Dyson. Can you hear me? A quick question. I had bad connection for a moment in the midst of Brother Dreit speaking. Did you also say, Brother Dreit, that the Moderna vaccine is approved now for a booster dose?
So no, I think 2 or 3 days ago they voted on it, so it will become available. Yes.
I got you. Thank you.
Right now it's Pfizer. Yeah.
Understood. Thank you.
Dr. Kendrick. Sorry, Dr. Mitchell.
Go ahead.
Yes.
So I absolutely love what you said. So, but I also want to add something to it. So, like that, I think oftentimes, participants or patients or people are just kind of looking at it from maybe a very individualistic perspective. So like, why do I have to do this if it's only affecting me? They're not realizing how it affects the entire community. But I think also looking at like what things you can do personally to, some other things you can do to also remain healthy, right? So like eating healthy food and staying active and getting adequate sleep. Those things are important for your personal health, and also making sure you're doing things to help yourself not contract other diseases. And then like making sure you are going to your doctor regularly and getting your healthcare maintenance. So like if you have a chronic disease, you're taking your medication regularly, and like I said, you're going to your physician and things like that, because all those things play a part in the person being healthy, but also realizing that you have to take a part to make sure your community is healthy as well. Does that make sense? So that's kind of what I tell other people around me as well. And also,
yeah, that's a great added perspective. Absolutely.
And your mental health. I think a lot of people's mental health is kind of just waning at this point during the pandemic. And so figuring out ways to boost your mental health and your self-esteem while we all kind of navigate this pandemic, I think that's really important as well. That's my add.
Dr. Dyson, just jumping in, piggybacking on what you guys are saying, another perspective, people want to have control in a situation, especially in the midst of a pandemic. You feel like you're in the eye of a hurricane or eye of a tornado. What are you to do? Wherever you move, you feel like you're at a loss. So understanding from the perspective of comorbidities, if obesity and smoking are going to be the two main ones that are going to lessen your chance of survival, heighten your risk of dying from contracting COVID, I would suggest, for patients, and that's what I do, to lose weight and actually stop smoking, do these things that you have control of to increase your chance of being able, lessen the number of comorbidities. If you have more than two, you're at a greater risk, but if you can get down to one, that really helps. Obviously, age, you can't do anything about.
Thank you all. This has been lively. And so I think we've kind of reached the end point of our first, the way we're kind of breaking up the session today. So why don't we, because I know we have some questions in the chat box and questions that we've received before, to jumpstart the questions, we're going to go to a video from a radio personality, 92Q Persian Nicole. So we're going to have her video, and then I'll just start shooting out questions to the panel and get it going.
Just like you, or your auntie, your uncle, your brother, your sister, your cousin, your best friend, because we all were very hesitant about this COVID-19 vaccine. We're like, oh, what is this? Did they make this overnight? What is coronavirus? They don't even know what coronavirus is, honey. But really, they did. They were studying coronavirus for years. This is not something new, and I did not know that. And so I actually did my research and talked to doctors and different scientists. Because social media will tell you anything, honey. They'll tell you the aliens is coming tomorrow, but they ain't coming tomorrow. Hopefully they're not coming tomorrow. Either way, I had to stay off of social media and really do some real research. I had to dig into some real facts. And by talking to doctors and scientists, doing my research, that is exactly why I'm vaccinated fully to this day. And I wanted to live my best life. I didn't want to be on a ventilator in the hospital fighting for my life. I wanted to have Christmas to my family, my friends, and have girls' night and have Thanksgiving and live for my 6-year-old son and my family. So that's why I got vaccinated. I hope you do your research, and I hope you choose what's best for you and your family. Stay safe.
All right, so that was good perspective from exactly the purpose of why we have this forum today. Is we wanted to provide exactly what Persian Nicole was talking about, an opportunity for folks in the community to get good information, trusted information, solid information, but also information that, because even though we have letters behind our names, we have family members who call us. We have family members who ask us questions, text us. They see stuff in the news and they're hitting us up. Well, everybody doesn't have folks like us in their family. So we wanted to provide this forum right here to give access to just people that just want real information. And so going off of one of the things that Persia Nicole said there, and she was talking about how do we know this is, how do we know it's trustworthy? Dr. Kindred talked a little bit about, and also Dr. Dyson talked a little bit about clinical trials. Can you say a little bit something more about that? And so that folks who maybe don't know what that means, and maybe given, and also when you're talking about clinical trials and the clinical trials that are necessary to get FDA approval, which these vaccines have now, talk about those clinical trials that were run, and then talk about the sheer enormity of the number of people that were in these clinical trials in comparison to some of those others. So we'll start with Dr. Kindred, and then anybody else that wants to jump on that.
So with clinical trials, actually, let me back up. When we talk about research, I think what annoys us as physicians when patients said they did their research, honey, that was a Google search, right? Research to us is you took, maybe start off with tens or hundreds of patients, and you made one change, right? You see, does turning the temperature down make them cold or not? And usually compare it to a fake version of whatever that is. That gives you more data. You then take a larger group of patients and do the same thing. It was tens of thousands of patients of diverse background. And we as Blacks are actually overrepresented in the vaccine trials. And so we can trust it. It's funny because some patients will tell me, well, I don't know what's in the vaccine. And then I have to say, well, if you're in the hospital, you don't know what we're injecting you with. You don't know what we're infusing you with. You can find out more right now about what's in the vaccine than you will ever know when you're intubated and all the drugs and medications that we're giving you. And I think one of the things we also have to address is the well-deserved mistrust that our community has in the medical community and has in clinical trials. And I'm sure, like you guys, my grandmother did not sit me down and talk to me about Tuskegee. It wasn't necessary, because to this day, there are, we're having personal experiences where the medical community is insensitive, not taking us seriously, so on and so forth. And while all of that is true, sis and bro, I still need you to get the vaccine, right? We can fight that battle. We still need to fight the battle, but for now, we need you to survive to fight the battle. And we can tell you the clinical trials do indeed prove that they're safe and effective. I intentionally took a slightly different spin because I know Dr. Dyson is gonna answer that question as well.
Oh no, your spin is perfect because it just had me thinking your approach in saying that, look, what you think you have control over on the outside really means nothing when you get into the hospital, such that you're concerned about what's in the vaccine. All that discussion of your Google research is out the window. When you're in the hospital, when you get admitted to the hospital, the objective is to get out and not make it to the ICU. First off, right. Avoid the ICU. And if you're going to get out and stay away from the ICU, you have a higher chance of getting out. But all the while, day by day, yeah, it might cost you $100,000 a day in the ICU. But that $100,000, what does that entail? What does that include in terms of your radiation you're exposed to, in terms of the imaging, all the medicines that are put in you, even what's on your skin? Every time they put an IV in you, you're at risk. So patients want to have control. People want to have control and have that armchair discussion of, oh, I don't know what's in the vaccine. But let a panel, let a family have a choice of saying, okay, look, my loved one, my grandmother, as you're saying, is going to the hospital. Do I want her to go through whatever it takes for her to be saved and come out? Or I want to be able to sit there and Google search each of the things that you're going to do to her before it's done so I can give you my approval. Because that's going to take a while. And while they're waiting for that, their grandma's going to be dying. So chances are they're going to sign off saying, you know what, do whatever needs to be done to save my grandmother. And they don't really care about, in that setting, what all goes in the side effect profile of medicines. And even as you combine medicines, it's just all about trying to save that individual. So people, and I was thinking, Brother Mitchell, when you're speaking, seatbelts. You don't have a conversation with people about wearing seatbelts. People wear seatbelts because they understand what it does. If you don't wear your seatbelt, you get thrown from the car. Well, you understood. You didn't wear your seatbelt. So in this setting, if people want to run around and not get vaccinated, there's proof now, as Dr. Roseman mentioned, you already have 21 months we're into the pandemic. You already know the outcomes of people that are suffering from COVID. So in the next 21 months, what's it going to look like? Well, it depends on what people decide to do. And the other part I wanted to mention is, imagine if you could go back to 1918 and had a conversation with all those people that started the pandemic. Hey, everybody, there's a vaccine that's available. If you opt to get the vaccine, then your chance of success is this much greater. Would you be willing to do it? I bet you back then you would have had people wouldn't have had this discussion about, we don't know what's in it. They were like, oh, death versus life? We'll take life. And so they'll get in line and they would have gotten it.
So, Dr. Mitchell, I have a question to piggyback off what Dr. Kendrick and Dr. Dyson said. So when you guys are seeing patients and they're coming in, oftentimes, especially the younger generations, are getting a lot of their information from social media like TikTok, Instagram, Facebook, whatever they're using now. How do you help them navigate where to get the most correct information instead of getting it from sources off of the shade room or like whatever else people are
Great question.
That's where my comment about your research actually was derived from. So usually I know what my patient's profession is, right? A hairdresser, a lawyer, whatever, and I usually will take that, right? So for the hairdresser, hairstylist, I'm saying, so if I watch YouTubers on how to do hair, can I call myself a hairstylist? And they are thoroughly offended. It is hilarious. Like they want to clutch their pearls. I said, exactly, right? So you have access to me, but you want to go on social media and tell me, myths and controversies. So it's a way that I can connect right away, because the patient came to me for their hair loss, their acne, their eczema. They didn't come to me for COVID, but I have to figure out how to fit that COVID situation is. So that's my tactic. And they get it. They get it right away when I turn the tables, if you will. So I usually will airdrop them a link from my iPad to CDC. They actually done an excellent job with some resources, but for the ones that are a little bit skeptical, I send them to NMA, National Medical Association. I'm sure you guys are familiar with them. They had a wonderful task force on COVID that I feel really related to our community.
I love that. So it really just sounds like you're meeting them where they are, so they can understand it exactly. I like that. Thank you for sharing that.
Thank you for that, and thank you both for bringing up it wasn't actually one in our questions, but I'm glad you brought that up, and I wanted to kind of talk about that a little bit more, about the healthy distrust that Black folks have, and as educated Black folks on this panel, I'm sure we all have, even what we know, it causes us to even have a more of a healthy distrust of what's going on and what's coming from the government. Even me working for the government, being in those discussions and in those rooms and hearing decisions that folks would likely make, even when I'm in the room. So then I'm like, you just know what kind of decisions are getting made when we're not in the room. So with that being said, can we just, because we have a few minutes, can we just explore how we use that healthy distrust, but at the same time, when does it reach a threshold of taking advantage of something and I'll just throw an image that I remember out when the vaccines first started out, because Dwayne and I are California guys. I remember neighborhoods in LA where it would be just people like us there, but the lines of folks getting the COVID vaccine did not look like us. And so at what point do we as Black folks have that healthy distrust for it to be healthy? And when does that distrust become not healthy? I guess that's a good way to ask it. And what do we need to, where does that threshold look like, and how can we get there so that we don't go into an unhealthy distrust?
So I'll jump on that. In terms of the distrust, back to my point I was making earlier about being able to have control. If parents and people realize that you have control in terms of getting the vaccine, then the inequities that, inequalities, I should say, that take place in the hospital setting that you hear about, like you hear that at least even through summer of last year, and I'm sure going into this year, that the number of Hispanics are dying at a higher rate than Black folks, than white folks. You know, is it 17 per 100,000 for Hispanics, all the way down to 2 per 100,000 for white folks? So then you look at, okay, the care that's received in the hospital. Well, Black folks, you can ask most Black folks, and they'd be able to say, I would say, or a smattering of them would say that, yes, there is a disparity in the hospital setting. Once you get in the ER, who receives care, the triage process, all the way up into the hospital, all the way into the ICU. So if you realize that there is disparities there, the one thing you have control over is being able to get the vaccine to help your chances. Because once you get in the hospital, you don't know if you're going to get the same care as a person in the next bed, regardless of their ethnicity or their sex. So exercise your control, get the vaccine, trust the fact that it'll protect you, because you don't know if the healthcare system, once you get in there, will actually manage you in a fair way.
I intentionally held back on this question. Thankfully, to the year-long race, equity, and health training that I received not too long ago from the Horizon Foundation, it really trained me on how to peel back the layers of this onion that we have in front of us. And I jumped on the deep end of this pool, if you will. And the group that I feel is the worst hit, and I'm biased, is Black men. And the way that I found to get to Black men is not me, actually. It's another Black man to talk to my Black male patients. Well, we're faced with the fact that there's more, and you guys know this, there are more Black men in medical school in 1980 than there are today, right? And so that means our future isn't as bright as we like to think it is. So we are intentionally trying to mentor Black men to help them. And thank God for organizations like Alpha Phi Alpha Fraternity Incorporated. But we're trying to mentor more Black men to make it to medical school, to help them navigate around these trap doors that are set out for them, so that for the next pandemic and the pandemic after that, we already have an army of Black men in place to reach this group that has been pretty much ignored for quite some time.
Thank you. Thank you. This is as I'm chatting with the folks in the background, and we're just making sure that we're sticking on time, and because the conversation is just really juicy and rolling right now. We want to make sure, because we know that there's folks online right now, we want to give an opportunity for anybody right now to put your question in the chat box or the Q&A box, and we have folks at the ready to be able to, as we say, come off the dome. So we'll just pause for a few seconds and see if there's any questions in the chat box. If not, I have one. Okay, so I'll ask a question in case folks are thinking, and they'll have some time. My question is to Dr. Rossman. So you were talking about how phenomenal Howard County has been with our uptake of the vaccine. And can you just maybe talk about some of the things that we've done here in Howard County that can be duplicated across the country to help some of the things like that we've seen with our equity in getting the vaccine out there and getting the message out there, so that some of the things that maybe across the country folks could do that could be duplicated?
Yeah, and I'll pick up where Dr. Kindred sort of left off. Lots of us get our information or trust the information from people that look like us, live in the same community, our kids go to the same school, we participate in the same rec leagues or whatever it is that may be. So recognizing I'm a white middle-aged lady, okay, doctor, whatever. I may resonate certainly with certain populations, and I certainly loved your analogy of family, right? People texting me all the time, family members to do that, but general people in the community don't have that access. So we made a deliberate effort in Howard County and the health department to find trusted advisors, trusted community members like yourselves to bring the message to particular communities, be it, moms with young kids, be it our millennials, be it our Black men. We went to barbershops, we went to the churches, we still do it. We go to Terrace Market, the different marketplaces, because Howard County, like LA, is a really diverse community, and there is no one size fits all. And the other part is the cultural humility. We all have to recognize that, and I'm, as a physician who was trained a bit ago, that just because I may think people should do something the way I think they should do, that may not be necessarily right for my patient, and give people the opportunity to make the choices by providing the right information and the honesty and the resources, so that, again, depending on their situation. And Howard County, we continue in that effort. We're not done, right? And we'll never be done, because the pandemic hopefully will become endemic and we will move on. We still face health disparities in our community, maternal and infant disparities that we have been working on for years, and that's still really concerning. And so we really have to continue with our efforts to really break down whatever barriers, cultural, et cetera, biases that exist both in the hospital and outside the hospital that create situations where some people receive better care than others.
Thank you for that. Just I want to highlight. Oh, I see Dr. Dyson came off mute. Wait, go ahead.
Yeah, to Dr. Rossman's point, I appreciate the long-range thinking. Going from a pandemic to an endemic is going to be just like what happened with the flu, Spanish flu, as they call it, from 1918. That prior to that, obviously, if you think back, there wasn't an annual flu shot, where now we have it. So I think going forward, there'll be an annual COVID shot. Then you might get down to probably about 30% of the country will get it, just like they get the flu shot going forward. But how are people prepared for the next pandemic is going to be more of how do they relate to the medical community, as we've kind of hinted at in this panel, and how do they get their information that's considered reputable information, so then they can make informed decisions. So yes, that's kind of what we're trying to tackle, chip away at that iceberg for this particular pandemic. But in essence, we're also setting the stage for people to be prepared, the next generation, if you will, for the next pandemic, and how is that managed?
Yeah, thank you all for that. This has been super exciting. I think unfortunately we're out of time. So I wanted to just thank everybody. It's been really good. I'm getting excited over here, and I'm a solutions guy. I wanted to just kind of end with what Dr. Dyson and Dr. Rossman just said about looking forward. And I think one of the couple of the takeaways from what Dr. Rossman said were things that we could duplicate. And that is, you said that the government can look for trusted advisors. And the other thing you said was cultural humility. And that is, I think those two are big things that are, because look, we have the information, we have the think tanks, we have the leaders in Black communities. But I think those two things, along with that healthy distrust, is the government really needs to do those two things that Dr. Rossman said, and that is look for trusted advisors in these communities, and then also to then have the cultural humility to say, hey, can you show us how to get this information to this group of people? When the government does those two things, then I think we see what we see in Howard County, and that is some really, really good success. Wanted to thank all our panelists here, Dr. Kindred, Dr. Rossman, Mr. Dreit, Dr. Dyson. This has been awesome. Thank the Horizon Foundation. We are gonna close things out here. We have some resources. Again, this is recorded, so you can watch this at any time. Check the links on Horizon Foundation. We're hoping to do something like this again in the future, so keep an eye out. And Marketing for Change. I think that they're going to have a video with resources to close us out. Again, thank you again to the panelists. We appreciate your time, and we are very, 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 very thankful that you guys came, that you all came here. Thank you. Marketing for Change.
HocoVaccines.org is different from most websites about the COVID-19 vaccines. It's specifically designed to help those who are trying to make a decision about getting vaccinated. There's no pushy language and no judgment. It just gives you the information you need so you can decide for yourself. Available in both English and Spanish, the site allows you to weigh the trade-offs of getting vaccinated versus not getting vaccinated, showing potential outcomes for both scenarios. It also provides straight answers to important questions like what's in the vaccine, how were they developed so quickly, and what are the short and long-term risks. We know that after getting a COVID-19 vaccine, some people feel tired for a day or two, but some of us have responsibilities that can't be put on hold. So the site offers resources to prepare for potential side effects, like the number to call for free legal advice if you need to ask your boss for time off, and list of companies offering free childcare to those getting vaccinated. And if you're ready to get vaccinated, you can see where to get a free shot in Howard County. Give it a try. Go to HocoVaccines.org to get the information you need to make the right decision for you.